The February 27, 2012 meeting of the Public Safety Committee will now come to order. Will the clerk please call the roll?
Mr. Antelli? Chairman Hanna?
Here.
Mr. Willie Lightfoot is excused. Mr. John Lightfoot? Mr. Michike? Mr. O'Brien? Dr. Quattro? Mr. Racco? Mr. Yolovich?
Is there anyone signed up this evening for a public forum?
There is not.
Is there anyone present this evening that would like to address the committee? Seeing none, we will move on to the next item on our agenda. A few weeks back, Legislator Willie Lightfoot had asked if we could bring Mr. Donaher, the public defender, in to give a brief state of the PD's office. I contacted Mr. Donaher. He graciously agreed to come in this evening. Unfortunately, Mr. Lightfoot is unable to be with us, but Mr. Donaher, would you like to step forward and give us just a very brief state of the office, and if there are any questions, we can have a few questions. Absolutely.
How very would you like the brief to be? 2 minutes? Okay.
Put the timer on.
And I will abide by, of course, the timer. I appreciate the opportunity. I tell anyone who will listen that I always enjoy talking about the Public Defender's Office because I truly think it's an asset to this community. It really is. The men and women who work there, both as attorneys and support staff, they work extraordinarily hard for the county and its residents and for this body. We, and I'm very proud to say, we have an excellent Public Defender's Office, and I think that certainly if you were to go out in the legal community, they would tell you the same thing. And the reason we have an excellent Public Defender's Office are those men and women that work there. They work extraordinarily hard. The second reason we have an excellent Public Defender's Office is due to you, this body. Over the years, this body has dedicated resources to the Public Defender's Office to make sure that it remained an excellent Public Defender's Office, and we appreciate that very much. And I'm just not, to use a common colloquial term, blowing smoke. If you were to look at other public defender's office in New York or even across the United States, you would see that they're usually grossly underfunded. And situations where attorneys with limited experience are hired and paid $18,000, $19,000 a year to handle criminal cases in those jurisdictions, and that is a crime. Here in Monroe County, this body years ago when it created the Public Defender's Office, and year after year after year, has made a commitment to dedicating resources to the Public Defender's Office to make sure that we do our jobs well. And when we do our jobs well, you can be assured that the system of justice here in Monroe County is working. If we weren't well funded and we weren't doing our jobs well, you would begin to question whether or not the justice system in Monroe County was a fair one. Well, I can say that thanks to your commitment and the administration's commitment to providing resources to our office, we're doing a good job for Monroe County citizens. So that was under 2 minutes. I thought I'd leave any questions you may have. I did submit an annual report. If you had a chance to read it, I certainly welcome any questions you might have in regards to what's contained therein or any other issues you have with the Public Defender's Office. Otherwise, I would say that things are going very well in the office. Of course, we do have our issues, but all in all, things are going well. So, and yes, Legislator O'Brien.
Thank you. First, I just want to say how much I appreciate your being here, and although Legislator Willie Lightfoot isn't here, we will be sure and brief him on your brief presentation. And I know that he very much appreciates your willingness to come. And as a member of the legal community myself, I think it needs to be said that I completely concur that our Monroe County Public Defender's Office we're all very, very proud of. The work you do is unparalleled by any county in the state and maybe in the country, and you've done really a truly outstanding job, and that does need to be noted. So if you could do one thing for me, it would be to just continue doing what you're doing because you do a great job.
Well, Legislator O'Brien, I appreciate your comments. Thank you very much. I'd like to take the credit. However, it's the staff that obviously they're the ones on the front line providing the services. So they deserve 99% of the credit. So I will pass your comments along to them. It's much appreciated.
Legislator Lightfoot.
Thanks. Thank you. I did read your report, just so that you know. And as I read it, of course, you begin to develop these questions, right? Me being new, I have to come over the learning curve. So, and I came up with about a dozen questions. And as I continued to read on, some of those questions became answered. later in the document, so or shortly thereafter, the next page. But I think maybe out of that dozen, I may have three good questions, three substantial questions that I may have. But I did not bring my report with me. So can I forward the questions to you?
Absolutely. In fact, if you'd like to come down to the Public Defender's office, I'd love to give you or any other legislator a tour of the office and talk about any issues you may have. I would look forward to, as I said, I love talking about the Public Defender's office.
Yeah.
So
No, I don't think I have any serious concerns. I'm not out to get you. Okay. Yeah. It's just questions that come along, so that we can better serve our community together.
absolutely.
Okay. Thank you.
Are there any other questions this evening for Mr. Donaher? Seeing none. Thank you very much for coming out. We appreciate all your service.
Thank you, everyone.
The next item on the agenda is the approval of minutes. You have before you the January 23rd, 2012 minutes. They will stand approved unless the clerk is notified of any changes before the end of the day. Next item is new business. Madam Clerk.
Referral 12-98, authorize intermunicipal
Moved
agreements.
by Legislator Michkay, seconded by Legislator Antelli. Is there any questions? Legislator O'Brien.
Thank you, Mr. Chairman. And through you, if we could just get a brief description of how the different contracts amounts are established. Is it established based on prior year's usage, or how do we arrive at the different amounts that different counties are charged?
Through the chair, the contracts are based for the 2010 budget on submissions in the year 2012 for submissions on 2010.
Okay, and just in a brief kind of way, if you can capture, what kinds of things are the counties using, or is the full range of services that are provided at the lab?
They're using the full range of services. However, most submittals from the outside counties are drug submittals.
And lastly, through you, Mr. Chairman, if it turns out that some county used substantially less services than we expected, or substantially more, do you readjust year to year? Is that taken into account the following year when you enter into contracts again?
Through the chair, yes, it is.
Okay. Thank you.
Are there any other questions? Seeing none, all those in favor signify by saying aye. Aye. All those opposed, item carries. Next item.
Referral 12-99,
Moved by Legislator Antelli, seconded by Legislator Yolovich. Is there any question? Legislator O'Brien.
And through you, the Regional Health Information Network or exchange that the referral addresses, is this something that Monroe County is familiar with already, because either Monroe County or some of its entities, like maybe Monroe Community Hospital or something, is already joined the exchange? Through you, Mr. Chairman.
Yes, through the chair, both the hospital and the health department are already a part of this. So the jail will be joining those entities.
Okay. And maybe this isn't fair. It just struck me as this referral struck me as a little odd, and maybe I should have been struck that way, in that the jail really isn't a healthcare provider in the sense, I know that they provide medical services at the jail, but people don't go to the jail necessarily for healthcare provisions. And is this kind of a new step for the Regional Health Information Network, or what would be the explanation for why the jail would be advantaged? And I guess also, why would the Regional Health Information Network be advantaged by participation with the jail, at the jail?
Through the chair, the sheriff is required, pursuant to the correctional law, to provide medical care to all inmates. This would be a big assistance to the jail, in as much as every time a new inmate comes into our facility, once the jail is a part of RIO, the medical staff at the jail would have instant access to, for example, any prescriptions that inmate is on, doctor's records related to health issues that inmate is now bringing into the jail. It's basically going to assist the jail medical staff to to assist the inmates in the provision of their health care.
And through you, kind of the converse of that, for the Greater Rochester Regional Health Information Organization, who are providing a gift of software, what do they get back out of it? Is there a contract that they're providing services, or what's the incentive for them to want to extend the network in that way?
Through the chair, at least in the beginning, I mean, this is a complete gain for the county. The RIO is a not-for-profit agency that's interested in, enhancing the provision of medical services and healthcare to everybody. And, these grants are kind of aimed with that as the goal. So basically what they're getting is a greater population in their database,
Right.
which, medical records are generated in the jail, which will then go into the database so that when that inmate is out of jail and goes to his or her physician, everything that occurred while inside the jail will follow the inmate.
Thank you. And last question through you, Mr. Chairman. Just, I don't know exactly what kind of information is collected, but I imagine that some might wonder whether or not personal information, might be available. Is it true that the system will be accessible by medical personnel, or would it be accessible by anybody that works at the jail? Through you, Mr. Chairman.
Through the chair, you need a username and a password, which for the most part will be restricted only to medical personnel as well as auditors. The RIO does random audits where they pick out individuals who are a part of the system and just run their names and then audit who has looked at their records, and then tracing back whether or not that was authorized. They also audit every user to ensure that the users are only looking at medical records that are appropriate. And every inmate that comes into our jail will sign a release. If he or she does not sign a release, they will not be, their medical records will not be inputted into the RIO system.
Thank you very much. Appreciate
You're
it.
welcome.
Mr. Chairman, are there any other questions? Legislator Lightfoot.
Thank you, Mr. Chairman. Through you. So as I was listening, I think what I heard was that there is my question was there a qualifier? What deems a person, an inmate, or into the system? Is it been there a week, 2 weeks, 6 months, a year? But I think I just heard you on this. I guess my concern for that is that someone can be there for a weekend or something along those lines, and then the information is data inputted or information is transferred all the way around, and sometimes some of the security issue is safety around that. But I think what I heard you say to Legislator O'Brien was that the inmate would have the option to sign on or sign off to be into this system. Is that what I heard?
Yes, through the chair, only inmates who sign a release indicating that they're willing to have their data and medical information inputted, only those inmates' information will be inputted into RIO. The inmate has the right and the power to say no, although I stress that this is something that is beneficial to the inmate. That's the goal, that's the purpose, the reason why RIO exists. In terms of when the inmate would be asked to sign the release, I can speak generally, or I have a captain from the jail who can speak specifically. We are required to give each inmate a comprehensive physical within 14 days of admission, but shortly after any admission, they're given a general screening, which is when information would be initially generated.
No, through you, Mr. Chair, I think that knowing that the inmates may have an option to sign on or sign off, and I guess if it's just made available to them and they know that they have, and hopefully maybe at one time they may change their mind and have the opportunity to opt in as time goes on. Thank you very much.
Thank you.
Are there any other questions? Seeing none, all those in favor signify by saying aye. All those opposed? Item carries. Next item on the agenda is unfinished business. Is there any unfinished business to come before the committee this evening? Seeing none, the February 27th, 2012 committee meeting of the Public Safety Committee stands adjourned. The next meeting of the Public Safety Committee is scheduled for Monday, March 26, 2012 at 6 p.m.